Well, good morning, everybody. Thank you for joining us. My name is Rep. Liish Kozlowski, Ozawa Anaquad. Yellow Cloud is my Ojibwe name. I use they, them pronouns. I'm really proud to represent Duluth and also a proud Two-Spirit person and the trans non-binary person, member of our caucus here. We're here because, as you know, Children's Minnesota is one of a handful of pediatric hospitals across the country facing relentless federal intimidation, including threats of investigation, revoked funding, and even potential civil or criminal penalties. Their decision that was announced yesterday to pause certain gender-affirming care services is a direct result of these escalating federal campaign attacks to punish hospitals for doing exactly what every hospital should be doing, and that is providing evidence-based, life-saving care to patients and families. We're gathered here as lawmakers, as community leaders, and most importantly, families and children who are deeply disappointed and gutted by this decision nonetheless, and it has sent shockwaves across our state and across the country. And I just want to say to every single trans, non-binary, Two-Spirit youth out there, you have every right to feel sad, to feel heartbroken, and to feel pissed off.
That's right.
You are loved and lovable, and you deserve the care just as any other kid in this state and this country deserves. Children's has been a beacon of hope and joy, providing compassionate, evidence-based care to youth and families, rooted in body autonomy, care, compassion, and belonging. And I will say that as representing Greater Minnesota and families who have come seeking refuge across the country, this will have an outsized impact. Even a so-called temporary pause causes massive disruptions for care, breaks trust between patients and providers and the families, and it really causes our families to have to scramble for alternatives and overall drives them further away from healthcare where we already face massive discrimination. This is a profoundly heavy and dangerous moment that we're gathered here as our community continues to face aggressive efforts to be erased. This is nothing more than that coordinated federal attack, and representatives and others will talk more about that, but this is really political theater. It's the same political theater against our kids and our families as this government is caging and detaining our children here in Minnesota and kids of color and immigrant children. Gender-affirming care is a wide umbrella from social support to self-expression. In some cases, there's puberty delaying medication that allows kids to just breathe and hit the pause button that they need to make the best decisions for themselves, to feel home in their body. This is life-affirming and life-saving care, and as someone who uses gender-affirming care in both the Twin Ports to here in the Twin Cities, I know the extreme joy and relief at taking those steps and actually being able to receive the care that you need to feel home in yourself. That first affirming haircut, to having your pronouns and name affirmed, to that first dose of HRT and being able to feel like my body is my own. That is what our children are experiencing and waiting in anticipation. And unfortunately, that is what this administration and what politicians out there are trying to rip them away from. I also want to acknowledge the stress that families are enduring of having to go to multiple clinics, having to go to multiple pharmacies, to blood draws, and all of that gets in the way. I'll say shame on this administration for wagering the lives of our nation's youth for political gain. When children tell us who they are, we should listen, we should love up on them and support them. The other message that we want to send today, in addition to a call to action, is that gender-affirming care remains legal, best practice, and evidence-based. Our laws are strong, our values are clear, and our commitment is unshakable. We will fight to the bitter end to protect our trans youth. I've been reflecting a lot as a Mexican and Ojibwe person in this time that we've been raising the alarms, that attacks on us are attacks that are going to land on your doorstep next, and they are here. If this administration and officials are spending hundreds of millions of dollars to attack our healthcare, for trans people and entrenching regressive norms, then those same people and corporations are hoping you don't notice when they're raising everybody's health care, sabotaging our public good, and compromising everybody's well-being. So pay attention. We need you all in. For anybody who is a person of good conscience and goodwill in Minnesota, to our institutions, to our hospitals, to elected leaders everywhere, stand up against this tyranny that is happening on our lands and on our people. Match the courage and the bravery of Minnesotans. Speak up, fight back while you still can, for our freedom and yours. We are grateful in Minnesota to have many leaders standing up, leaders like Hannah Edwards, who are also supporting our families, and I want to invite her up to the podium next.
Thank you. Hello, everyone. My name is Hannah Edwards. I use she, her pronouns. I'm the mom of 2 amazing daughters, and my oldest daughter is trans. I'm also the executive director of Transforming Families Minnesota. We're Minnesota's largest support network for trans and gender-expansive youth and their families. I stand here today representing over 1,000 group members in our private community. Many of them would be here to share their stories themselves, but it's not really safe for our families to speak out publicly. So I'm here to share how this pause in care affects our trans children and our families. I want to start by saying that we love our doctors who provide gender-affirming care. We build deep, trusting relationships with them, often over the span of many years. These doctors listen to our children. They help guide our families in making thoughtful, healthy decisions about medically necessary gender-affirming healthcare and our children's futures, all based in best practice and medical standards. These decisions are life-saving. What we do not appreciate is the intimidation that HHS and the federal government are placing on our physicians and our care providers. We also do not accept that this pause in care represents what those physicians or we as parents know to be best practice. We as parents do not accept that this pause was inevitable or that it's acceptable conduct from our healthcare providers. Even if this pause is temporary, whether it lasts weeks, months, or longer, it will have real and detrimental effects on our children. I'd like to share some of the reactions of our Transforming Families group members to the news of children's pausing parts of their programming with you now. I'm tired, one youth said to her parents when they learned about this pause in care. They're tired because this is just another institution which has determined it's too hard to continue to care and support for them, said their parent. I want everyone to think about just how much our trans children have faced in this last year from the federal government. If you haven't been paying attention, it's more than most people will face in their lifetime. Our kids deserve access to healthcare that helps them thrive instead of constantly being questioned, delayed, or paused. No wonder they're tired. Yet another parent who just moved to Minnesota in this last year after we passed Trans Refuge said, "This is what we moved to Minnesota to avoid. Our family uprooted our entire lives to get to a place where healthcare was protected by the Trans Refuge law, to a place where we could access our child's healthcare without disruption." I want everyone in this room to also know that this is not a small number of people. We have dozens and dozens of families in this position who've just moved here and more coming. Families who left behind jobs, schools, support systems, and their entire world just to get their child to safety. And now they're having to relive that trauma once again, fearing for the stability and protection of their child's care. Another caregiver in our private Facebook group posted hours after the announcement, "I just called the place suggested for continuity of care by Children's, and we can't be seen for an intake for another 3 months." When you're living with dysphoria, being told you must wait months after finally finding a provider you trust is not neutral. It is harmful. Interrupting care and severing established relationships with providers puts our trans children at risk. Children knows the impact of their decision will be severe. That is why they sent the number for the National Suicide Hotlines with their MyChart message announcing the pause in care. At the center of every one of these decisions are our trans children just trying to live their lives, and all of us parents who are doing everything in our power to protect our trans children whose bodies, mental health, and futures are directly affected by these threats. Trans youth are not abstract talking points. They're not political experiments. They are children who know themselves, children who are supported and loved by their families, who deserve stability, dignity, and access to their medically recommended care. Make no mistake that that care being paused or threatened is harming our trans children, and they're who's carrying this weight. If we truly care about children's well-being, then we must center the voices of those trans youth and the parents who aren't here today, and be brave enough to continue standing up for their access to care. We must listen to families who trust their children, and we must trust our doctors rather than forcing them to preemptively make decisions that go against their Hippocratic oath. I'm glad to stand in this community with all of those gathered here today who are working to ensure that our children have access to the care that they need without fear of interruption or political interference. I want children, trans children, and parents to know that you're not alone. We all will continue working toward a future where every young person can access affirming care without interruption or fear. Up next, I am really pleased to introduce Jess Braverman from Gender Justice.
Good morning, everyone. My name is Jess Braverman, and I'm the legal director at Gender Justice here in St. Paul, Minnesota. I want to start by making it clear that gender-affirming medical care continues to be legal in the state of Minnesota. That includes prescriptions for puberty-suppressing medications and hormones for trans kids. To the public who may not understand gender-affirming medical care, the federal government has spent years demonizing trans kids and their parents, terrorizing their medical providers, and misleading you about what gender-affirming medical care is. The medications we are talking about today, puberty-suppressing medications and hormones, are regularly prescribed to kids who are not transgender. It is only transgender kids who are losing access to these safe and effective medications. And this loss is devastating to the impacted families. And the physicians who the federal government is attacking for providing this health care are the same physicians families trust every day all across the state to treat other pediatric hormonal conditions such as diabetes and thyroid conditions. The medications are not dangerous, the physicians are not dangerous. What is dangerous is the federal government insisting on creating crisis after crisis in the state of Minnesota while offering no aid and no solutions.
That's right.
And so I want to be clear about what's happening that led up to the decision by Children's, and I'm not doing this to explain the harm of the pain of the families is real, the harm they've experienced is real. I'm only bringing this up because I want the public to understand what has been happening here. The federal government has attempted to withhold funding from Children's Minnesota, a hospital families rely on for gender-affirming care, for cancer care, for trauma care, for bereavement support for families who have lost children and who are grieving. They're threatening to withhold that care unless Children's Minnesota agrees to stop providing best practice medical care for trans youth. Depriving families of life-saving care does absolutely nothing to make healthcare more affordable, more accessible, or more equitable for anyone in the state of Minnesota. And to the trans kids and their parents impacted by this decision by Children's Minnesota, I spent a really long time trying to write something that would fill this void and address this. I have no words. This is horrifying. It is really hard to find a medical provider that you trust. It is really hard when that trust gets damaged. We at Gender Justice, we believe that gender-affirming medical care is mainstream medical care. It should remain in mainstream medical care. It should not be separated out and put in separate clinics. And we will do everything we can to ensure that the providers who continue to provide that care can continue to provide it in Minnesota, and to make sure the pause by Children's Minnesota that they announced as temporary is actually temporary, and that care can resume. Thank you.
No introduction.
I can't.
Yeah,
I couldn't even try.
well, thank you, Jess, and thanks to Liish, and thanks to Hannah. And I want to apologize in the beginning. I have to leave right after my remarks. My apologies. But it's beyond enraging that even one hospital or one doctor has been put in this position. And we cannot forget why or where the pressure is coming from. The federal government has its eye on Minnesota ever since Trump's inauguration over a year ago now. This is part of their ongoing attack on our state, our values, and our institutions. They don't like that we take care of our kids here, that we feed them at school, that we provide them with daycare, and we offer them life-saving care that gender-affirming care is so often is. And so they ratchet up the pressure on our institutions, which forces them into decisions that they seemed like beyond belief just about a year ago, decisions made out of very, very human fears. And this is the Trump administration's playbook, everyone. I could very well be at the same podium talking about what they're doing to immigrant communities. And here we are talking about transgender communities and our fellow Minnesotans. But it's their playbook. Coercion, threats, bullying. They don't like how we vote, so they cut our funding, or try to. We've been blocking them on that. They don't like the fact that we welcome immigrants, so they send 3,500 armed people to wave guns and even kill our fellow Minnesotans. They don't like how we approach children's health care, so they threaten our hospitals. Bullying and blustering is just standard operating procedures for Trump and his allies, but Minnesotans are smart enough and tough enough to know how to handle bullies.
That's right.
We saw it when tens of thousands came out to protest the illegal occupation of our state. We see it every day in the way people are looking out for their neighbors, doing mutual aid, and standing up to this tyranny. And I hope you can see it in the way that my office has been holding this administration accountable in court nearly every day. We will do it again and again every single time, including and especially when it comes to our transgender youth. I think it was late last December, RFK Jr. issued his so-called declaration to try to limit access to gender-affirming care for young people, threatening to punish any doctors, hospitals, and clinics that continue to provide it. We took him to court as part of a coalition of 20 states to block his declaration. But let me point out the obvious. It is beyond absurd for this man who has never spent 1 second inside of anybody's medical school or practicing medicine or in a clinic to get up and declare what is good and bad medicine. He doesn't know. I don't know, maybe it's proximity to power. Maybe it's the worm thing, I don't know. But it's broken, something going on up there. And let me point out how repugnant it is that a man who was born with every conceivable privilege, every privilege that any human being could ever possibly aspire to, uses that privilege to stomp on kids. That's right. It's repulsive, it's disgusting, and we'll never stand for it. March 6th is just 1 month from now. We have a critical hearing on our motion for summary judgment in our lawsuit against RFK's declaration. We also have a commitment in writing from DHS that they will pause enforcing the declaration for 30 days after the hearing next month. If the judge rules in our favor, and I am very confident that they will, I expect that they will, and we win our case, a win for the rule of law, a win for young people for whom gender-affirming care is life-affirming care. That's what it will represent. When we win, because I'm just going to claim it now, this pause in care from children must end. Must. So I want the trans community, my dear friends and neighbors who I claim as my own, and I want them to know this, that we will never back down. We're nowhere near being tired, and we will stand with them every single step of the way. And that's all I got to say.
That's all you gotta say.
Thank you.
Thank you.
You don't got, thank you for being here. You go do the rest of the good you're doing. Hello, everyone. My name is Leigh Finke. I use she, her pronouns. I represent District 66A in the Minnesota House of Representatives. I don't love following our Attorney General, but everything he said stands. So just a few weeks ago, I stood at this podium and talked about this administration's trans eradication policy in America. We have seen the revocation of our federal recognition across all law. We have seen discrimination protections dismantled in more than half of U.S. states. We have seen trans people and trans children targeted, lied about, scapegoated, and more. This is happening for a very specific purpose. This administration wants trans people gone. I say this not to justify what is happening to our healthcare, but to set the appropriate landscape for us to understand a decision like that which was made by Children's Minnesota. Children's has been put in an impossible situation by a ruthless administration that is trying to destroy their entire hospital practice. We have seen similar decisions by children's hospitals around the country because hospitals, providers, medical groups, insurance companies, and every other lever of the medical establishment is being pressured to stop providing gender-affirming medical health care to trans kids. This has been a long time coming in Minnesota. In 2023, in order to protect transgender children and adults and their access to gender-affirming care, the Minnesota Queer Caucus, along with our DFL colleagues, support from Governor Walz and Lieutenant Governor Peggy Flanagan, built the strongest trans refuge state in America. We did this because gender-affirming care is medically necessary, life-saving health care. We did this because in Minnesota, we protect our most vulnerable communities. Just look at what is happening right now in our streets. We stand together in Minnesota. Even before we passed the trans refuge law, the walls were shrinking for our community. Now that Trump is back in office, now that his national fascist project is being implemented with no regard for humans, for human consequences, especially for trans kids and adults, we are more at risk than we have ever been. Today, this action we are discussing is about our kids. Trans kids and their parents are among the most vulnerable populations in America. Many of these families, as you heard, moved to Minnesota specifically because we promised to protect their health care. And I want to be clear to those families, your health care is still protected in Minnesota. Children's Minnesota is making a heartbreaking decision to pause this care. I know it is heartbreaking for the providers at Children's, and I know it is doubly so for patients. It is painful to see this happen. It is painful to see the lengths the Trump administration will go to destroy our small community. Children's has declared this pause to be temporary, and I fully expect that they will return to their full slate of gender-affirming care in 60 to 90 days, as they have suggested. This care is still legal in Minnesota, and Minnesota's gender-affirming care healthcare providers must continue to offer it to all trans and non-binary patients. Yes. Our lives depend on it. Trans and non-binary kids and adults in Minnesota, all across the United States, deserve healthcare providers who will go all the way to the mat for them. We must fight all the way to the end for trans kids. We cannot continue to be sacrificed for the greater good until our community is simply gone. So we need you all to stand for us. We understand the difficulty, we understand the despairing situation and the risks, we understand every other five-alarm fire that is taking place in this nation right now. But we still need you to stand for us as well. This ruthless, uncaring, dehumanizing administration that we are living under is doing this work to everyone who is different, and that includes our most vulnerable trans and non-binary kids. And I thank you for coming here. I thank you for listening. I thank you for responding in the way that we need you to, which is to protect trans kids. With that, we'll take some questions.
it's been stated, you know, that this care is legal in the state of Minnesota, and, you know, Attorney General Allison has this lawsuit that's ongoing. Is there any other responses that, you know, state leaders have to this attack, or is it kind of just at this point standing on defense? I mean, is there anything else that you can do in response to this?
Do you want to take it? Do you want to take it, lawyer? Go ahead. All right. There's very little we can do in response to this. The truth is, we have every single law that we need in the state of Minnesota to protect this care. We have the Minnesota Human Rights Act, we have the Trans Refuge Law, we have the law guaranteeing insurance coverage for gender-affirming care. The apparatus of the refuge state is strong. The problem is that we have to go to court with these insane declarations and cruel policy changes, and to just be on defense all the time to hold what we have. I am sure that those who have stood for the trans community in our government continue to do so. But just like with every other crisis that we're seeing, our powers, our hands are limited. What we can do is limited in the state of Minnesota because this is our federal government, and it has been captured by an authoritarian project that's out of control.
And I would just add to that, as a civil rights legal organization, we do see it as our duty to make sure that the laws in Minnesota are enforced. Minnesota has constitutional protections for transgender kids. We have statutory protections for transgender kids. We do not want to see anyone singling out and targeting transgender kids for worse treatment because of who they are. And when we see that happen, we look at all of our options, and we often do take action. And so I just want to be clear, I don't want to see a pattern of people saying, well, I guess it's legal in Minnesota to single out and target trans kids. It is not. That is why the Attorney General is fighting it, and that is why we at Gender Justice bring affirmative lawsuits, not just defensive lawsuits, but affirmative lawsuits when we see discrimination happening. The problem is that healthcare especially, we see this, it can be legal and there can still be issues with access. And we're having very, very serious access issues. And when people can't access their rights, it's not very different from not having those rights at all, from the perspective of the people who need that care. And that's what we're seeing now, but I want the message to be clear that discrimination against transgender kids in the state of Minnesota is illegal. And this care continues to be best practice medical care and consistent with Minnesota values.
I think that's in line with my question. Just then, do you anticipate a domino effect? Are you concerned that there will be a domino effect because of children's decision?
We're very concerned about the federal government's efforts to intimidate providers. We also we represent also, let's say, abortion providers who we see have been under these types of attacks for decades. So we're seeing a lot of the same patterns there. We have faith that the providers who are providing this care will continue to do so. We would ask them to continue to do so. And if any of those providers are nervous or scared, they're welcome to reach out to us. They're welcome to reach out to the Attorney General's office. There are many litigators here in Minnesota who will do what we can to make sure that you can continue to provide that care. So it's a really scary time. Anything's possible, but in Minnesota, this care is legal, and we expect to see facilities continue to provide this care to transgender kids.
Yeah, that's exactly it, and I kind of spoke to that in my remarks earlier about just the expectation that hospitals and providers hold the line, and that's part of the mismatch and the hostage extortion situation that we're seeing when we have a hostile federal government using unilateral executive overreach powers to try and force our hospitals out of compliance with not only best practice and medical care, but with state law. And we're here to say that we are going to hold Minnesota providers and hospitals to making sure that they are upholding anti-discrimination and providing gender-affirming care to Minnesotans.
Hi, it's Erica Zurich from NPR News, and I'm curious, is the lawsuit from the Attorney General's office, I just want to make sure I'm clear and I have this right, is it the lawsuit that is about the Trump administration saying that hospitals that have provide Medicaid or get Medicaid and Medicare funding will not be sorry, I'm not speaking about this very fast.
the declaration versus the rules?
Yeah,
I just, yeah, sorry.
oh, yeah, so,
Question was very unclear.
no. So the federal government issued proposed rules, and right now they are proposed rules threatening to withhold certain federal funding from providers who provide gender-affirming care to minors. Those rules are not in effect, and there's litigation regarding those rules. There's also separately from that a declaration by HHS about providers who provide this care. It's based on misinformation, it's based on bad science, I would say junk science, and it's another attempt to threaten providers who provide this care. The Attorney General's office is litigating these threats. They are looking very closely and very carefully at these threats, and I know they're putting a ton of time, a ton of resources into trying to preserve this care in Minnesota and to push back on the misinformation and on this illegal conduct by the federal government, this ridiculous overreach into Minnesota where, they're trying to impose their values on us here, and our state is fighting back against that in court.
Okay, great. So Children's Minnesota has the temporary pause is, the timeline might be based on that litigation. Is that what?
Sure, I just want to make it clear that Children's Minnesota's action is about the declaration lawsuit. Because under the declaration from RFK Jr., after that was made, Children's Minnesota was specifically targeted and called out on Twitter by the HHS people as one of these being investigated. And then we had the action in court to put a pause on that. And that agreement said they would not continue investigation, but it did not sort of provide the security that those who had already been targeted were going to not continue to be penalized. So that's the distinction. There's about four, we could have a long conversation about, I think, what are the four tactics that they're using, but the CMS rules and the declaration are kind of two peas in a pod, but they're separate. And it's that declaration right now that has them making this decision.
Thank you very much.
Yeah.
That helped me a lot. Thank you. I appreciate you saying that.
Has anyone up there had conversations with someone from Children's? And are you at all able to talk about how those conversations have went?
Yeah, I'll take that. We work very closely with Children's. The director of their gender-affirming care program was an absolutely invaluable part of our work to pass the trans refuge state in Minnesota. I have met with that person and I've met with the CEO and the folks who are there. We're not separated from them. We're not doing this to pile on the decision that their leadership made. We have our feelings about it. Our families are terrified. But yes, we've been in communication with them. We have understood the position that they see themselves in, and those conversations will continue.
One last question? All right then, thanks everyone.
Thank you so much.